Here I will talk about the condition. Zika virus has no clinical symptoms, meaning that there aren't any symptoms from the virus that are specific to the disease. But the most common reported symptoms are fever, rash, headache, joint pain, conjunctivitis, and muscle pain. It's not determined whether these symptoms occur because of the disease itself or just a coincidence, since the symptoms last from a few days to a week max. The real problem is that it might be a factor in causing other major neurological and autoimmune complications, like Guillain-Barré syndrome and microcephaly. Recently in Brazil, local health authorities have observed an increase in this Guillain-Barré syndrome paired with this Zika viral infection in the general public. Guillain-Barré syndrome is a rare condition where the immune system attacks peripheral nerves, causing partial or full paralysis. Microcephaly is another condition associated with Zika virus and Guillain-Barré syndrome, pointed out by researchers. Microcephaly is when the brain and head are smaller than expected compared to the babies of the same sex and age. In the next slide, I will go over how the Zika virus is transmitted. I will now talk about the modes of transmission. There are a few ways the Zika virus can be transmitted. There's a direct method and an indirect method. How Zika spreads so quickly is from an indirect method called a vector. A vector is an infectious agent that carries the virus, in this case, a mosquito. Mosquitoes from the species Aedes aegypti and Aedes albopictus can infect a human through a bite. Uninfected mosquitoes become infected when they feed on a person already infected with the Zika virus. Infected mosquitoes can then spread the virus to more people through bites. The direct method occurs through skin-to-skin contact, kissing, and sexual intercourse, basically from human to human contact. In this case with the Zika virus, direct methods include mother to child, sexual transmission, blood transfusion, and possibly lab or healthcare exposure. Transmission from mother to child occurs when a pregnant woman can pass Zika virus to her fetus during pregnancy or around the time of birth. Zika is the cause of microcephaly and other several or severe fetal brain defects, as discussed in the previous slide. To date, there are no reports of infants getting Zika virus through breastfeeding. Zika can be passed through sex from a person who has Zika to his partner or her partner. Zika can be passed through sex even if the infected person does not have any symptoms at that time. Current studies are being done to find how long a Zika virus stays in the semen and vaginal fluids of people who have Zika, and how long it can be passed to sex partners. However, it's known that Zika can remain in the semen longer than other bodily fluids like vaginal fluids, urine, and blood. Blood transfusion is a direct method, with blood transferring from one body to another. While there aren't any documented reports of Zika virus transmission through blood transfusion in the US, there have been multiple reports of blood transfusion transmission cases in Brazil, and reports are being investigated. In the lab and healthcare setting, there have been 4 reports of Zika virus infections, all coming from the US since 2015. However, it's not clear what the route of transmission was for those 4 cases. In the next slide, prevention strategies will be discussed.